But we've got to get back to a big story on the day. After a whirlwind of development, the first doses of a long-awaited coronavirus vaccine are being administered. And as the Pfizer vaccine rolls out, the FDA could also authorize Moderna's candidate as soon as Friday. But while the vaccine is boosting morale for many Americans, it comes as the U.S. hits a grim milestone, surpassing 300,000 COVID-related deaths. And joining us now is U.S. Surgeon General Dr. Jerome Adams. Dr. Adams, always a pleasure to speak with you, and we appreciate you taking the time as you do. Do the recent vaccine developments make you optimistic that the end of the pandemic is in sight?
Well, they make me incredibly optimistic. 2020 has been a marathon for sure. And for any of you who've run a marathon, you know that the last couple of miles are the hardest, but it is easier to finish if you can see the finish line. And unlike the first surge or the second surge, we're in a terrible third surge, but we actually know that there's a finish line in sight, and we've got to run to the tape. And that means continuing to follow the 3 W's. Wear a mask, wash your hands, and watch your distance, particularly for young people, because the honest truth is we're going to start vaccinating the vulnerable and healthcare workers right away, but younger, healthier people are not going to get the vaccine until probably second quarter of next year. One thing you can do right now is get educated. Don't let misinformation rule you. Go to cdc.gov or vaccines.gov and get your questions answered, because it's normal to have questions. What's not normal is to let misinformation cause you to make unhealthy choices. And you can get your flu shot right now. That's another great opportunity to talk to your health providers about vaccine safety and efficacy.
Okay, and so I want to break that down even further here. Specifically, when we think about a successful timeline for a vaccine rollout, efficacy as well as acceptance, what does that look like for you?
Well, it's important for people to understand that this is a tremendous achievement to have 1 and hopefully soon 2 vaccines in less than a year. But vaccines don't matter. What really matters is vaccinations. And we know that vaccine confidence really could be much higher in the United States. I started off 2020 worried about the measles situation that was occurring across our country. Remember, last year we almost lost our measles eradication status for the first time in over 20 years because of vaccine hesitancy. But what I want people to understand about this COVID vaccine is that we've not cut any safety or efficacy corners. This is actually something I said on other news channels, but the millennials who watch Cheddar will actually get this. It's like your Xbox 5. You get your new game console, you want to play a different game. You don't throw out the game console and start all over again from scratch. You simply change out the game and you've got 95% of what you need already there. We took a vaccine platform that had been in use for over a decade, and we changed out the part to recognize COVID-19 or the virus that causes COVID-19. And that's how scientifically we were able to move so quickly. We knew the platform was safe, we knew it was effective, and we got here in record time. But we need you all to promote vaccine confidence among your grandparents, your aunts, your uncles, your parents. And we need you to get the vaccine when it's actually available to you so that we can stop this virus and get back to normal.
Dr. Adams, when we think about the base of essential workers that are among the first being inoculated with the vaccine, when we look at the makeup, the people of color in this nation, they make up the vast majority of essential workers in food and agriculture, industrial, commercial, residential facilities and services. And so this once again bears in mind the question of the comfortability of people getting the vaccine, and specifically the pandemic and its impact disproportionately on communities of color, and what the distribution strategy will be like for those communities beyond just those who work in essential services.
Well, I've said frequently, nothing has been on my heart more than the disproportionate impact that this virus has had on communities of color. African Americans, Hispanics, 2 to 3 times more likely to get hospitalized and to die from this virus, as well as Native American Alaska Natives. And we know that that's not just about pre-existing medical conditions, it's about pre-existing social conditions, transportation, housing, the ability to telework, that are disproportionately not opportunities that people of color have. But here's another social determinant of health, if you will, and that is vaccine confidence. And unfortunately, the federal government, medical institutions, researchers have done some pretty horrific things to communities of color in the past. And what I'm trying to do as Surgeon General is to help people understand the protections that are in place, like data safety monitoring boards, which are independent, the Office of Human Research Protections, to ensure that no one can be victimized again, to ensure that these vaccines will be safe and effective. And I've also been working with some of the companies you've been talking about, Pfizer, Moderna, AstraZeneca, Johnson & Johnson, to make sure they have an adequate representation of Hispanics, of African Americans, of Native Americans in their trials, so that everyone, people like you and me, can feel safe getting this vaccine. Again, it's not about the vaccine, it is about the vaccination, and we want people to feel comfortable getting it. Viewers, it's okay to have questions. It's okay to be suspicious, but what's not okay is to be uninformed. And I believe that once people have the facts about how this vaccine was developed safely, without cutting any corners whatsoever, and once they understand that it's 95% efficacious, it's how you can start to get back to normal again, going to school, going to spring break, going out with your friends, that more and more people will accept it. And the data shows that we went from 30% who said they'd get a vaccine a month ago to 60% 2 weeks ago to 80% according to an ABC poll earlier this week. I want to get us to as close to 100% as possible, especially in communities of color.
Certainly, and I think we all do look forward to getting back to a sense of normalcy and herd immunity through vaccination, and we know that as opposed to the alternative of herd immunity through just mass infections, a much better strategy. I do want to run through some of the numbers, and feel free to correct me if I'm wrong, on commitments that the U.S. has for purchase orders from each of the companies that you mentioned: Pfizer, Moderna, AstraZeneca. 100 million from Pfizer, Moderna 200 million, and AstraZeneca 300 million of the doses. And so with that in mind, these are purchase orders from Operation Warp Speed, but when they expire, is there any reason to expect that manufacturers would continue their commitment to fair and reasonable pricing?
Well, I certainly feel confident that they will, because this is the most scrutinized vaccine of all times. And we know that if they don't honor their commitment to really protect the planet, with the tremendous investments that have been made in those companies, we've taken the risk away from them by pre-purchasing these vaccines. I want people to understand that's another way we achieved speed. We paid for these vaccines up front so that the company had zero risk. And if they don't make it across the finish line, if they don't get authorized, that money is not lost for the company, it's lost for the taxpayers. And so I expect the companies will continue to provide these vaccines for the public. And again, as long as we see that people want the vaccines, they're going to make their money off of volume. They don't need to make it off of jacking up the price.
Surgeon General, just while we have you here, what do Americans need to know heading into the holiday season? Many people usually travel during this time of year to get together with family.
You need to know that it's going to be a really hard next 4 to 5 weeks, because we've had record cases for several weeks in a row, and those record cases are going to turn into continuing hospitalizations and deaths. I was in Montana just last week, and they had hundreds of healthcare workers who were out because they were in quarantine or in isolation. So understand that you may not be able to get care if you get into a car accident. Your parents may not be able to get care if they have a heart attack. Your sister or wife may not be able to get care if she's going into labor, because the beds are full with COVID patients. So we need to continue to stay the course, but understand it is not forever. There is a finish line in sight. We need to run through the tape. We can't afford to stand still or to go backwards. And running through the tape means wearing a mask, washing your hands, watching your distance, keeping household gatherings, keeping gatherings small and limited to the people within your household for a little bit longer. And once we get over this hump into 2021, we'll slowly start to turn the dimmer switch so that we can get back to normal. I promise you this will happen, but we need your cooperation.
As always, appreciate your time and having the discussion here with us today. U.S. Surgeon General Dr. Jerome Adams, appreciate it.